How do brain tumor biopsies differentiate types? How do brain tumor biopsies help doctors figure out the type of tumor? This process is crucial for accurate diagnosis and effective treatment. It all starts with obtaining a tissue sample from the tumor. There are several methods to do this, each with its own advantages. One common method is the stereotactic needle biopsy. This technique is minimally invasive, which means it requires only a small incision. However, it may provide smaller samples, making it harder to get a complete picture of the tumor. On the other hand, an open block biopsy involves a larger surgical procedure called craniotomy. This allows doctors to collect bigger tissue samples, but it is more invasive and requires a longer recovery time. Another method is the endoscopic biopsy. This technique uses a special lens and navigation tools to reach tumors that are deep within the brain. It helps improve the chances of getting a good sample. A newer approach, known as the boring biopsy, aims to collect cylindrical samples from the tumor core while being less invasive. These methods are designed to gather tissue that includes both the tumor and some surrounding normal brain tissue. This helps doctors understand how the tumor interacts with healthy brain cells. Once the tissue is collected, it undergoes microscopic examination. Pathologists look at the cells under a microscope to identify the tumor type and grade. They use special stains to highlight different features of the cells. For instance, a specific protein called glial fibrillary acidic protein can indicate the presence of glial tumors, such as gliomas. The pathologist examines the shape, density, and activity of the cells to determine how aggressive the tumor is. In recent years, molecular genetic testing has become essential in classifying brain tumors. This testing looks for specific genetic changes that can help identify the tumor type. Techniques like polymerase chain reaction and next-generation sequencing are used to analyze the genetic material from the biopsy sample. For example, the presence of a genetic alteration known as 1p19q code lesion is typical of oligodendrogliomas. Additionally, mutations in the IDH1 gene can be found in certain types of astrocytomas and are linked to a better prognosis. Advanced imaging techniques, such as magnetic resonance imaging, also play a role in understanding brain tumors. These imaging methods help guide the biopsy and provide additional information about the tumor's characteristics. They can show how the tumor is infiltrating surrounding brain tissue, which is crucial for treatment planning. In summary, brain tumor biopsies differentiate tumor types through a combination of tissue sampling, microscopic examination, and advanced molecular testing. This thorough approach allows for precise classification and helps doctors create personalized treatment plans. Always consult with healthcare professionals for the best guidance regarding brain tumors and their management.